Good evening, everyone. I am Armando Ivista, and I'm going to present the Melzack wall theory. Melzack wall theory. The gate control theory of pain asserts that non-painful input closes the gates to painful input, which prevents pain sensation from traveling to the central nervous system. Therefore, stimulation by non-noxious input is able to suppress pain. So dito, si Melzack and Wall, they propose a mechanism for how pain is reduced by activating a non-painful sensation. Sinabi rin dito na gate control theory asserts that activation of nerves which do not transmit signals called non-nociceptive fibers can interfere with signals from pain fibers. If you're going to ask how gate control works, so following an injury, pain signals are transmitted to the spinal cord and then up to the brain. Melzack and Wall suggest that before the information is transmitted to the brain, the pain messages encounter nerve gates that control whether these signals are allowed to pass through the brain. So in some cases, the signal are passed along more readily and pain is experienced more intensely. In other instances, pain messages are minimized or even prevented from reaching the brain at all. The next one is the one proposed. The first proposed in 1965 by Ronald Melzack and Patrick Wall. The theory offers a physiological explanation for the previously observed effect of the psychology and the pain perception. So silang dalawa yung nag-propose ng theory na ito. Yung Melzack-Wall theory. Pain signals can be interrupted in the substantia gelatinosa of the spinal cord, which act as a gate. So makikita nyo sa picture and how it works. When you hit yourself a hammer, then rubbing the injured hand, yung painful stimulus niya, nare-reduce yung pain. So sa A8, sa painful stimulus, yung A8 and 5 C fibers is going to the primary neuron. Then secondary neuron or sa contralateral ascension in spinothalamic tract. Then synapse to the tertiary neuron. Mag-extend siya sa thalamus to postcentral gyprus. Until dun sa, hanggang sa mapunta siya dun sa tertiary, which is a brain. At maging aware yung brain na, or consciously aware dun sa pain. The next one is the deep touch. Deep touch to Pacinian corpuscle. Then to the DCML or the cercolomedial along to the medulla oblongata. Then crosses over the medial lemniscus of the brain stem. So dito pinapakita lang kung paano yun, kung paano magiging aware or magiging conscious tayo dun sa may pain na dun sa pain, like just by hitting yourself a hammer. So hindi agad siya nararamdaman. So may mga ano pa siya, process na dinadaanan tulad nga dito. The next one is the pain suppression and management. Pain is interpreted and perceived in the brain. Pain is modulated by two primary types of drugs that work on the brain, the analgesics and the anesthetics. The term analgesic refers to a drug that relieves pain without loss of consciousness. So analgesic drugs are used in a single or combination to affect peripheral or central nervous system. Dito, it decreases the pain sensation. At present, the most widely used medication for management, like acetaminophen, opioids, and non-steroidal anti-inflammatory agents, while the other one is the train center anesthesia, refers to a drug that depresses the central nervous system or the CNS. So anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. The next one is the opiate analgesia or analgesia. The most effective clinically used drugs for reproducing temporary analgesia and relief from pain are the opioid family, which includes morphine and heroin. There are currently no other effective pain therapeutic alternatives to opiates. Several side effects resulting from opiate use include tolerance and drug dependence or addiction. Dito naman sa pain modulation, sa opiate analgesia, most effective siya use drugs for producing temporary relief from pain. It includes tolerance and drug dependence. So in general, these drugs are modulate that incoming pain information to spinal and central sites, as well as relieve pain temporarily, and also known as opiate producing analgesia. It is an antagonist drug antagonizes the opioid effects such as naloxone or matroxone, and etc. They are competitive antagonists of receptors. The brain has a neuronal circuit and endogenous substances to modulate pain.